Hello there, my name's Julie Highfield and I'm one of the psychologists in the ICU. My main role is to look after staff well-being. So this is a bit of an introduction to looking after well-being when working in the ICU and some thoughts and ideas for you. I think it's really important that we recognize that well-being at work is not just about you as an individual, even though that's what I will focus on a little bit more in these slides, because this is aimed at what you can do to look after yourself. It's also about what we can do to look after you. It's the way we organize the job and the overall department. It's the way you form relationships with your peers and they with you, and the way the managers in the service look after the staff and each other. But thinking a bit about you and your job on an individual basis is a really nice, simple model called the job demand resource model. And the idea is about balancing the demands of our job versus the resources we have to do the job. Now, resources might be about us as individuals, our coping strategies, our belief, our support, our peers, but it's also about the resources to do the job, the equipment, the staffing, the environment. If we get the balance right, then we go down to the engagement level. We feel happy and we feel like we're doing our job well, and it creates a great performance in us. We're safe in work, we feel driven, and we feel a great sense of joy. Get the balance wrong and it can lead to all sorts of psychological problems which can be clustered together and called burnout, and it really impacts and decreases our sense of performance, drive and joy at work. And there are lots and lots of demands working in the ICU. It gives a lot. It's fantastic when we get great patient outcomes, the sense of camaraderie and teamwork and being in this together, the complexity of challenging cases and the variety of the work, the real highs of the roller coaster. However, there are huge lows as well, and you can cluster them together to think about the emotional labor or the emotional part of the work. Dealing with the complexity that we see, witnessing traumatic things happening to patients and their families and the distress they go through, the way in which we can't always change things and there are limitations, and of course end of life. We can often feel useless when working in the ICU, and actually that stress we can take out on each other in the team. And it's really important to understand there's a very physiological response going on with stress. So if we start on the left-hand side, we perceive something as a threat or a stressor. So it may be that our demands are far greater than our resources. What we're witnessing today is really, really taking it out of us. Our brain responds to that as if we're in a burning building. So our amygdala and our hypothalamus actually trigger a threat response, which releases adrenaline initially and then cortisol over time if it's sustained. And that leads to a whole host of physical and cognitive impacts in the moment and then potentially long term. So our heart races, our breathing rate increases, our pupils dilate and our mouths get dry, and we have a sense of tunnel vision and focus, and we might feel sick and we might feel like we need to go to the toilet as blood is diverted around the body away from systems that are considered not necessary right now, and to the systems that are needed to respond to the emergency. And what's really important in that is that our thinking really is affected by stress. And if our systems continue to respond to low level or chronic stress or repeated moments of high stress, then we can show signs of chronic stress. So these include feeling tired, yet not being able to sleep, feeling edgy or hypervigilant, having mood that's up and down, or particularly low or anxious, or irritable, and feeling like we can't quite get into our normal routine. So things such as our appetite are affected, our general bodily symptoms and functions are affected. So let's think about some basic ways to manage your body stress response, because get the stress right and actually it can feel quite exciting working in the ICU. But get that balance wrong and we can feel tipped over the edge. So when we're stressed, our minds race and our bodies start to react with physical symptoms, as I described, and it becomes quite hard to think straight. So a really important 3-stage way of managing stress is, when you notice that you're racing, is to say to yourself, stop, and then breathe, and then think. So what we want to do is create this biofeedback through our breathing back into the stress system to stop that stress response, so that we can re-engage our frontal lobes and start to think clearly again. So I want to take you through just a little breathing awareness exercise that you can do. So hopefully this link will work. What we're going to do is just, I want you to count your breaths over the next minute. How many breaths in and out do you take? Okay. I'm just going to pause it when it gets to 12. Oops. So as we're just pausing that now, think to yourself, how many breaths did you take in and out over that minute, where in and out counts as one? Some of you, it would have been quite low. Some, it might have been a little bit higher. If it's any higher than 12, that suggests that your resting respiratory rate right now is probably showing signs of stress. Sometimes when I do this with people, it's as high as 20 breaths a minute. So people are really over breathing. What I'd like you to try is to see if you can just slow your breathing down to a rhythm that we associate not with relaxation, but with calm readiness. What we're going to do is use the second hand as the clock as a bit of a trigger, if you like. So we go from second hand to second hand, breathing in and breathing out. I'll take you through it just to explain it. So if we start again, start breathing in and out, and in, out, following the rhythm of the clock. In, out, in, out, in, out, in, and finally out. Okay, So hopefully you would have had some sense of maybe getting into that 10-second breath rhythm. Some of you might have found it slightly harder. Some of you might have had the urge to breathe even slower than that. Somewhere between sort of 4 to 10 breaths a minute is associated with a calm readiness. And it's a really useful technique to use just to give you a moment's breathing space in the bed space. You can do it for 20-30 seconds. You can do it just before a job interview. You could do it after work, on the way home, just as you start your car. And it just brings that stress system down. What you're doing is you're activating the parasympathetic branch of your sympathetic nervous system, and it kind of soothes and creates a counter response to that adrenaline and cortisol release. And this just gives you a way of describing that if you didn't like the clock and you prefer a written version of the technique. Sometimes our mind just races no matter what we do. So a really good distraction technique that you might probably find useful after a shift, or maybe during a break when you're trying to switch off and your mind is just racing. So to just say to yourself, stop, and then take yourself through a mundane task. So a really good one is spotting all the green things in a room, or going through the alphabet to a list such as people's names. And what it does is it overloads your working memory with benign thoughts, and it gives you a chance to slow down that body's stress response and clear your mind. So I personally find this really useful when I'm struggling to fall to sleep at night, and it just really clears your head. But I think the reality is when you work in critical care, it is a roller coaster and you need to step off at regular intervals. I think our staff are particularly good at working themselves incredibly hard, and you need to find some time to switch off, relax and unwind in any way you can. Certainly outside work, but inside work, please do take your breaks. And if you can on breaks, step outside or take a walk in the corridor. Try that breathing space we just did, but maybe try it for 2-3 minutes to get the full benefit. And take moments when you're in shift to just pause and look out the window and take notice of something outside the hospital, just to ground yourself in the here and now. And it's a way of just counteracting that body stress response and activating our parasympathetic nervous system. One of the biggest threats that we can all experience, and it's very hard because it's an internal threat, is our thoughts and the way in which our thoughts interfere and irritate and create problems for us. So notice for yourself, how do you consider and judge situations in yourself? Are you self-critical? You tend to blame yourself and push yourself to do a better job? Do you struggle to treat yourself with the compassion you deserve? Are you a worrier? Is your mind always asking, what if? And what do people feel about me? And if you have a lot of frequent negative thoughts, they can actually activate that stress cycle in the background without you realizing it, especially if you're the kind of person to think over and over and over things. So just a couple of ideas with that. Again, saying to yourself, stop, is very, very important. Being mindful and taking notice of the thoughts that are there enables us to then make choices. So when you start to notice the patterns, you can start to question your thoughts. How do I know what I'm thinking is true? Is it fair for me to judge myself this way? And as you start to notice your old habits, you can start to break them and form new habits and more helpful habits in thinking. One of the thoughts that goes round and round a lot of people's heads are what they witness on shift. So it's quite often people will see something negative, and be it the distress of a patient or a family member or another member of staff, or be it a critical incident at work. It's important where you can to process these things rather than trying to suppress them. So if you feel able to, find ways to talk about it, check in with your colleagues and have that hot debrief, or maybe check in with yourself and write a personal journal about it. You might find that actually you think better when you're moving. So for some people, exercise that involves movement helps them to think through and process. So going running or going cycling or on a long walk. And certainly downtime and space to think and space away from work where you're not constantly bombarded with reminders can be helpful in the short term. If you have a colleague that you see experiencing this, it's important to not force them to talk about it, but allow them to come to this in their own time and just remind them that you're there for them when they're ready. However, sadly, some people do develop symptoms of post-traumatic stress. So usually in response to a specific incident or a series of incidents. And usually there's some kind of hook that means it churns around in our mind. And what's actually happening with post-traumatic stress disorder is our mind won't allow us to put the memory away. It feels like something's not quite right. So it keeps it very fresh and at the forefront of our mind, and it sort of goes around and round and round in circles. So typical things that can trigger this off is if there was a mistake or things were unusual or not following protocol, or there might be something outside of work, such as being a first responder in a road traffic accident that kind of reminds you to work, but you can't create that same professional distance. And there might be something about the patient or the family that just particularly resonates with us. They might remind us of someone we know, they might link to our family in some way. And up to a quarter of people who experience a traumatic event might go on to develop more serious symptoms. And serious symptoms start to develop after about a month. It's very, very typical to experience some of these symptoms for the first month, but they do naturally go away of their own accord. But it's called post-traumatic stress disorder if it continues to exist after 4 weeks after the event. And there are 5 main symptoms that we look out for. One is any kind of intrusive remembering of the event, what we typically call flashbacks. So images and an experience, and we feel like we're back in the moment. Or lighter ways, we might have bad dreams, or it just might be just constantly on our mind. Our tendency is to try and block it out and avoid any reminders of it. It impacts our thinking. Our thinking can be quite negative and our mood can be quite negative. And we can feel a sense of edginess and something bad about to happen. And of course, all of these things really impact our day-to-day thinking and functioning. Sometimes when people experience longer term stress at work, this is where the idea, the concept of burnout kicks in. And burnout is a syndrome, i.e. it's a cluster of symptoms that tend to appear together over time. But in my experience, there can be a bias towards one or other of those 2 top symptoms, the emotional exhaustion or the depersonalization. So with the emotional exhaustion, it's that sense of there's just nothing left to give. We can feel very over involved with patients and relatives, but we feel absolutely helpless, and it doesn't matter how much we rest, we just feel like we never quite restore. And there is this tendency to feel like the patients are starting to get under your skin, and it's a very defended position because it's very hard to create a professional distance. Or there's depersonalization, which can feel like the opposite end in many ways, where we feel completely disconnected from our emotions and we're overstating our boundaries and we're avoiding work, or we kind of disconnect from the patients themselves. And this is where we'll tend to describe patients as bed numbers rather than their personal experiences. And this is where people can get into bad habits of dampening their emotions with food or alcohol or nicotine. And there are other kind of psychological defense mechanisms that kind of kick in to stop the mind feeling overwhelmed, and that depersonalization can almost feel like the opposite end and a reaction to emotional exhaustion. And then the third symptom, which is kind of in the mix with either, is just feeling like you're not getting anything done. You're not achieving at work. Maybe work isn't the way you want it to be anymore. And these problems tend to arise if staff are exposed to this frequent trauma and there's no space to make sense of it and process it. So the mind finds a way to cope, and it's these defensive styles of coping that become entrenched because people don't know any other way. And so here's just a different way of describing burnout on more of a spectrum. So you've got that disconnection, depersonalization at one end, and that emotional overload at the other. And you can be in either blue or red at any one time. And the idea is that in order to be well at work, all of the literature around burnout says the opposite to burnout is engagement. So it's feeling in balance and feeling enthused by the job and feeling like you're doing a good job. And a way to think about this psychologically and how to achieve that state of mind is to think about feeling protected rather than defended from the work. So it's a safe and healthy distance from the work where we're able to share stories. We can detox and debrief and talk things through in our own ways. There's ways that I described before, but we still feel very connected to the emotional impact of our work, but we feel able to ride those waves of emotions. So the stress comes, but we can breathe through it. We can talk ourselves through it. The negative thoughts come, but we can counteract those and talk our way through them. And we can set good boundaries where we leave work at work. And when we are in work, we feel able to connect to our patients and our families, but we don't feel completely entrenched in the story and feel like we have to give beyond ourselves and give more than we have able to give. And also, we won't do things in isolation, we'll access support. So those are key things of kind of overcoming burnout and trying to find that balance and feel engaged with work. And at the end of the day, the most important message is that in critical care, we give plus, plus, plus. So the way we take care of ourselves and each other should be plus, plus, plus. So just being very aware, as I've said, about those resident cases, but also just aware about your own stress responses. Be aware of that negative thinking and try, if you can, to treat yourself with a level of self-compassion. Think about finding your own space to reflect and share, be that in a diary, be that down the pub with your friends, be that in a huddle at work. Just think about that effective roller coaster riding. It might feel very exciting, but we can't ride it all day, every day. We need to take some time out and we need to step off the roller coaster and restore. And just be very aware of that burnout cycle and that avoidance, and think of being more protected in your disconnection and your professional distance at work. And it goes without saying, and I'm not going to go into the detail of it, but do take care through your own lifestyle. Don't forget the basics. And I'm about to go on to culture, but the most important thing from an individual point of view is that you are the culture and you can be part of the change. And the way in which you deal with your stress absolutely impacts the atmosphere of the unit. And where you can, get access to professional support where you need it. And I'll talk at the end slide about the options available to you. Just a note on culture and peers. So if you look on the left-hand side, when we're all in balance, when we're all balancing our demands and our resources, and we're all looking after our stress well, then we feel like collaborating. We feel the sense of camaraderie, of high morale, of good support, and we communicate and we feel safe with each other. But get the balance wrong in a group and we start to go into survival mode. We hunker down and we do what we need to do to get through the day. And this is where cliques form. And this is where people can feel rejected and excluded. And this is where negative behaviors and bullying can occur. So all of us managing our own stress is really, really important. But also leaders are incredibly important for setting the tone here and encouraging that atmosphere of thriving collaboration and support. So if you're a zone leader or a band 7, this is really, really important for you to know how important you are as part of setting the culture. As an individual, it's important to recognize that those stressed out colleagues can be challenging to you. And it's just a really important thing to think about, that when our brain is planning for war, it does not focus on pro-social behavior at all. So we do lose that social fabric. For yourself, it's important to say, what's my stuff, what's their stuff? It's their stuff, they're stressed. If you can, try not to sponge it up and take it to heart. Try where you can to find your buddies and your allies, and store up and internalize all the positive feedback, be that from patients or relatives or from your colleagues, to just balance some of the negative impacts of how colleagues deal with stress. And on our website, there are ideas for shift huddles, and these are quite tricky during a time of high PPE, but these are the things you can do with each other. So zone leaders can lead in this, but actually you can do this as band 5 and 6 staff with each other and as healthcare support work as well. So you can ask to your buddies around you, how's everyone doing today? Is there anything positive from shifts we've had before that we can really make use of today? And actually, how can we make our shift okay for everyone? And if one of you needs help, how will you let the other ones know what's going on? Just a way of checking in. And you can do that at the end of the shift as well, and see, how did people do today? Are there any learnings from today? And actually, as you go home, how can we let go of the day? And is there anything people feel that they need to leave at work and talk about now? So just the last slide. Obviously, this is just a very brief overview. Sometimes people need extra help, and that's the reason why I am employed to work with the critical care service. So I am the critical care psychologist for pediatric and adult critical care, and I offer group and individual sessions to staff, and you can self-refer either as an individual, or if there is a group of you that want to talk about an incident at work or a shift together, you can just get in touch with me via my email there, julie.highfield@wales.nhs.uk. But I can understand that not everyone will want to come to me directly, and they might prefer that distance. And in Cardiff and Vale, we do have a counselling service within employee wellbeing, and there's the website for you to self-refer to the counselling service. And of course, you can access help by your GP if you prefer to get help completely separate to work. In Cardiff and Vale, there are actually some really great courses that you can self-refer to, and you don't actually need your GP to refer you to, and that's on the Stepio website. So that's STEPIAU. Okay, take care of yourselves out there. I hope this has been helpful. Thank you very much.